staying healthy, staying sexy, staying young is what living life is all about. And if you have doctors that have proven treatments that keep people young and healthy so they don't get sick, you want people to know about these treatments and that they exist.
This episode is brought to you by Gainswave. Gainswave is a treatment done at your doctor's office to optimize erection quality without the needs of Viagra, Cialis. It's non-surgical, there's no needles, and it has an amazing success rate. To find a Gainswave provider, go to gainswave.com. That's GAINSWAVE.com. This is Mark L. White with Health Hacks, and today I'm here with Kelly Engelmann. Kelly, how are you today?
I'm doing great.
Well, welcome to the show. It's very interesting. You're a practitioner. You're a nurse practitioner in the great state of Mississippi, correct?
Correct. Absolutely. Central Mississippi.
What I think is interesting, though, is you specialize in functional medicine, and you also specialize in sexual wellness.
Yes. Yes.
Are there a lot of people like you in Mississippi?
Probably not. No, absolutely not. But I kind of fell into functional medicine in 2004, before it was really a big, well-known thing. I mean, in Mississippi, functional medicine is just now becoming a buzzword, right? And I started in the realm of hormone replacement therapy. I had been in conventional practice for about 8 years in women's health, and kind of saw a huge gap after the Women's Health Initiative in women's ability to get their hormones and get balanced, and just felt passionate about my role in that. So I started out with females, and then over the course of years, as I became more aware of the sexual gap that can happen in marriages, I decided to go and pursue a sexual health certification through A4M. So I did that a few years ago, and it's been really good. I would say now about 50% of my patients are men, whereas before I was exclusively female.
How do you get the word out? You started in 2004. You're in a state that is more conservative. I mean, was it a long climb to get awareness out, and were there a lot of people who were turning their backs on what you were doing?
Yeah, I mean, and my approach is very conservative in that, I do believe in getting someone balanced hormonally is way more than prescribing hormone replacement therapy. And so our approach has been a food first approach from the very beginning. And I think in taking that approach, where we're working on drivers of inflammation as the primary root, and then building everything else on top of that foundation, I think it's been really easy. I mean, we've got a huge word of mouth following, and results work. So when someone gets a result, they're going to tell their friends. And so it's been slow in some regards, but it's been the pace that it needed to be.
Okay, with a focus on sexual wellness, do you get a lot of women that show up and they have their guys in tow and say, hey, help my man get better in the bedroom?
It doesn't usually work that way. Usually the females come first. And as they work on their overall health and they see improvement, the spouse sees improvement. And then they get interested. They start asking questions. They start asking to be able to come to the visit and to be able to get some help for themselves. And so I'm sure there are conversations behind closed doors that I don't have an opportunity to hear between husband and wife in that regard. But most of the time, men are seeking it out at this point. They're the ones raising their hand and saying, me too, let me get in there and get myself worked out as well.
So with women, what are the hottest sexual hacks you see? And who are you working with? Are you working with younger women going through menopause, older women, all types?
It's really all types. It started out that 40 to 55 range was where I started to see patients in the beginning. And I would still say the majority of my patients are within that age group. So perimenopausal to menopausal age group. And it's migrated more toward the younger population now. And I don't know if it's just more awareness that there can be things to improve sexual health and wellness. And I'll say this, I believe that your sexual health is kind of the barometer for your overall health. And that's relationally as well as sexually. And so, yeah, I see younger women coming in saying, maybe they're just not having orgasms, or they are having pelvic pain with intercourse, especially after childbirth and things like that. Those are patients I didn't typically see 10 years ago.
How much of that is hormonal versus something else going on?
Yeah, I would say a tremendous amount is hormonal. I would say at least 75 to 80% is hormonal. But you have to think about hormones are driven, right, by inflammatory drivers. And so it may not be that they can't make the hormone. It may be that they're being overexposed to certain hormones through our environment, the food sources that we eat, or maybe they're not processing the hormone very well through the liver and it'll show up as a dysfunction.
So you work with them, I'm sure, on diet. Are there certain aphrodisiacs like that? If a guy's listening to this, anything he could be giving his wife to have her achieve a better orgasm?
That's there is a hot list of foods. I think anything that decreases inflammation in the body is going to help with overall libido and performance. So keeping the diet really anti-inflammatory, which doesn't sound that sexy, but it definitely works. So making sure, that you're eating the rainbow, lots of fruits and vegetables, staying away from processed foods as much as possible. We all hear about strawberries and avocado and things like that boosting libido, and they do work, but it's not going to outdo what you're, doing with a poor diet. It's not going to work that way.
Do you have a lot of people that come to you and they don't want to change their diet? They want you to fix everything, but they're not going to lay off the cheeseburger?
I'm sure I see some of those patients, but it's not the normal, because with our structure and with our, outreach that we've done throughout the years, I think most people coming in have been pre-educated, so they kind of know what our philosophy is coming in. So they're willing to make some changes. I did see a gentleman this morning that came in and he was kind of in that mindset. He just wanted a procedure or just wanted a pill. And we had a long, frank discussion about his underlying health condition, sleep apnea that's unaddressed, lots of inflammatory burden that's unaddressed. And at the end of the day, he was willing to make some changes. So we'll see how that works out for him. But it's a conversation that I feel obligated to have.
So with hormones, with women, I know that there's creams, there's pellets. Are there any that you gravitate towards, injections?
Yeah, that's a great question. I think I use them all to answer your question. I think they all have their place. And so it really depends on the age of the patient, the risk factors of the patient, and then what they're trying to accomplish. So I love testosterone pellets in the perimenopausal woman, where they've seen a dramatic decline in not just libido, but cognitive function. The brain needs testosterone to produce dopamine. And so we'll see some cognitive blunting and things like that. And so I really love using hormone pellets during that age group. I like the creams for my postmenopausal women that want to keep their hormones optimized. And so it really just depends on what we're trying to accomplish, what their goals are, and what's going to work best for them at that current age or situation.
What are some of the hottest treatments for women right now?
So hottest treatments for women, that's a loaded question, right? We're actually looking at implementing some sexual health wellness treatments for vaginal health within the next year, but we haven't implemented those yet. And that's looking at improving vaginal lubrication, and Votiva is the name of the thing that we're looking at. But I think there's certainly a place for that, a non-invasive procedure that women can have done to help improve, vaginal tone and lubrication.
So a lot of like optimizing sexual performance, obviously it's working with couples.
Yes.
So you have a lot of couples that come in and they want to improve their sex life. Where does functional medicine stop and you say, wait a second, you guys need to go talk to somebody? Do you ever have those cases?
Absolutely. Yeah. We're very blessed in our area. We have a great counseling company that work with couples. So it's a counseling couple that works with couples. So you have a male-female therapist with a male-female patient. And that works really well. So yes, there are times when they need it all. They need the counseling and they need the therapeutic side of things in the way of hormones and nutrition. So yes, we're blessed to have that as a resource.
Is it hard to talk about, like, I'm just thinking about Mississippi because it's again, conservative. Is it hard to
Right.
get patients to open up when it comes to sexual issues?
I don't think so. I mean, I think they're willing to, I think they just need a safe space to talk about it, right? A no judgment zone, safe space where they can be honest and real and have their questions answered and really express what they're experiencing and understand better what their options are for resolution, right?
Mhm.
So I haven't found that to be a difficult conversation. Sometimes it's hard to get the conversation started, but once they understand, look, this is a safe space, you can talk about it, then it opens it up.
So a lot of times, I guess it starts with a woman. How does she bring it up with her husband or her boyfriend? Does she say he doesn't have the erections, he's not attractive to me anymore, or he's not attracted to me anymore? How
Well, I
does that
have to
happen?
tell you, I think the saddest thing that I see, you just kind of hit the nail on the head. And this is one of the reasons why I felt obligated to do a certification in sexual health and actually work through some of this with women, because what can happen is you get into a cycle where, that perimenopausal age, he's going through the same thing. Erectile dysfunction happens about 5 to 10 years before cardiovascular disease. So, as men age, they lose the ability to have proper blood flow. And as a result, will start having some sexual dysfunction. Well, she's going through her perimenopause, menopausal age about that same time and thinks that she's less attractive to him. And maybe that's the issue. Sometimes he thinks that she's less attractive. And so he'll be promiscuous, trying to see, do things work again? Right? Are they going to work with someone else? Right?
That'll get
And
him in
so,
trouble.
exactly, right. And so, having some preemptive conversations with couples so that they understand that that thought process is common and there are other ways to deal with figuring that stuff out other than being promiscuous and, breaking the trust of the marriage. And so I think it's a really fun place to be in that regard, and being able to work with couples and navigating that very delicate time in life.
Mhm.
So
Yeah,
if we can get them both on the same page, great.
yeah,
Right.
you should have like a him and her special. Get them done at the same time. What are the guys doing right now? I know obviously testosterone replacement therapy helps with a guy's libido, but it's not going to help with the promiscuity.
No, no. And that's I think every man's battle. I can't say every man, but I hear that from men, right? I think that's always going to be the temptation is there, and learning how to deal with that is everyone's journey, right? And how to help manage that best. Um, I think being able to have open dialogue helps. Being able to say, this is how I'm feeling and this is what I feel like we should do about it as a couple certainly helps that process, so that they feel most people want to feel heard. They
Mhm.
want to feel understood, they want to feel heard, and they want to be accepted. And if those things stay intact, regardless of the physical issues that a couple is going through, I think the chances are much better that they'll recover and maintain their intimacy and sexuality.
One of the challenges I think with couples is that women they fall in love emotionally, whereas men are driven physically.
Yes.
How do you
How do we navigate that?
how do you not? That's got to be tricky. What kind of tips do you give to couples where she just wants to be held and he just wants to have sex?
Yeah, so I think that when you think about like your whole sexual wellness, right? We want to think about how to stimulate senses, how to make things fun and adventurous for both. And so really focusing some of their efforts on things like that can go a long way of taking that battle, that struggle between just the sex and just the snuggle. What can we do that's fun for both? And really embrace it from that standpoint. Then if you just dig your heels in and say, I just want to be cuddled, and he digs his heels in and says, I just want to have sex, well, you're not going to get anywhere. No one's going to get what they want, right?
So what do you like? Give me some examples of some fun stuff you've recommended for some of your couples.
So I think one of the things that I recommend a lot is maintaining a date night. Have a date night at least once a week, if not more, where it's just about you two. No kid talk, no work talk, just about what you're planning, what you're doing. Go have some fun, be a kid. I think that's that's a strong recommendation. The other one is exercising together. Exercising together produces endorphins, and those endorphins are what stimulate sexual interest. And that's a really good strategy for a lot of couples to maintain intimacy and physical closeness, is to really spend some time working out, whether that's a walk or whether that's in the gym. yoga class, whatever works for them. But being physical together is also super important.
Okay, that sounds good. Now with men, us men, we act different than women. When they come to see you about ED, and you get them on testosterone, you do other treatments as well. I know you do Gainswave. You're also doing P shots. Tell me how those are working for the guys.
Yeah, so it's a layered effect. So we want to make sure testosterone is intact. Can they produce testosterone? I see young guys that are coming to me already on testosterone therapy, and I don't think enough attention has been played to, could you get them to make testosterone on their own? And are they so inflamed that their testosterone is not working? So really wanting to maximize their ability to make testosterone as best we can. Now, after andropause, they may need testosterone, and absolutely we use it. So really targeting questions for them as to what's not working and how it's not working. Like, is desire gone? Are you getting early morning erections? Are you able to maintain an erection? What is going on? And in discovering what's going on, then that helps you come up with better solutions to repair and fix. I think the Gainswave therapy and P shots are working phenomenal. I mean, they're just really good adjuncts to helping turn that clock back about 5 to 10 years, depending. But we want to make sure we're addressing the underlying causes of what's going on as well.
I know one of the things that a lot of people have been talking about is the internet and porn. Do you have guys, they get addicted to porn, and does that affect the couple's relationship? And have you ever dealt with that?
Yeah, we do deal with that some. And that's a case when I absolutely do refer them. This couples therapy that I'm talking about, they specialize in sexual addiction. And so it really helps, again, take the stigma out of it and really work through the process of the why, because that can be a stumbling block for performance. If they're seeing things that are not realistic and that's their expectation, then they're never going to be able to be satisfied or connected. And so therapy can be a great strategy for that process.
Yeah, there's this whole thing. I think it's called like the no masturbating, like groups that, you've read about these guys that you don't masturbate and that makes you better in the bedroom. Some people say that's wacko. Have you ever dealt with that at all? Or does that
I
ever
have
come
not.
up?
I can honestly say that has never come up.
Okay.
Yeah. That's one I don't know anything about. You've just stumped me.
Well, I talk to a lot of people, but I'm not in that group, by the way. So,
Okay.
what else do you see out there? I mean, what give me just something fun or like just a case study that you've really gone in there and helped a couple get through like some serious issues and you've changed their lives.
Yeah, I'll say we had a gentleman come into us a few years ago that was really struggling with performance, and his wife was a little bit opposed to him getting help. And I don't know what she thought that would look like for him, but she was a little bit opposed to it. And so she's going on this vacation for like 3 months. She had this planned with the friend. They were going on this long journey. And so for
vacation.
3 months, we worked with him, and we basically changed his whole lifestyle while she was gone. And when she came back, she was convinced he was having an affair, because who else would change their diet, start exercising, lose 30 pounds, and so now she's our patient. She's coming in and she's getting herself taken care of. But that was the first time I'd had the man take the initiative to come in for himself and get himself really worked up and straightened out without a whole lot of encouragement and support from the wife. And then she followed his lead, which I thought was really cool. That ultimately she's, there are really strong couple together within the practice, but it usually happens the opposite way. So that was a lot of fun to see him take the lead. And then her reaction to it was really now comical. It wasn't comical at the time, because she was really convinced that he had stumbled upon something while she was gone. So
now that's interesting. Now another question. You said you started this in 2004.
Yep.
Like, why did you, like in Mississippi, you left traditional health. Was there something that caused you to go on that path? Was it a trigger event? Was it something in your lifestyle that caused you to
Yeah,
go down
so
that path?
I had always been fitness minded, right? I was a runner and I thought I was fit. I didn't know anything about nutrition, zero. And my husband developed a rare form of cancer and passed away.
Sorry to hear that.
Yeah, so I walked through that process of realization that there was so much we could have done, after the fact, and never wanted to be in that situation again where, I have patients looking at me and I know we asked, several times, was there anything he could be eating? Was there anything we could be doing? And they're like, no, just don't lose weight. It was not talked about. Nutrition was nowhere on the map of his plan of care. And that really piqued my interest, again, after the fact of what could we have done differently. And so I started pursuing education in that regard and realized there was a whole world of bioidentical hormone therapy for women that could get me started in that process of helping people.
Do you find like traditional medicine, because you've been on both sides, do you find that traditional medicine can work well with functional medicine? Are they diametrically opposed? Do you find providers poo-pooing what you're doing?
Yeah, so I do not believe that they should be opposed at all. I think functional medicine is adjunctive to conventional medicine. I think that I love having all the tools in my toolbox. I love being conventionally trained and then layering on top of that what I've learned in the functional world. I think that's beautiful. And I think that primary care providers partnering with a functional medicine provider makes sense because we will make their lives easier if their patients are healthier. They're going to see better outcomes in the therapies that they're recommending, right? So I think it can be a beautiful blend.
Are you starting to find mainstream medicine in your area is more receptive to functional medicine, or is it still somewhat taboo where you are?
It's kind of a mixed bag. We have some providers that are very pro, and I think they've had an opportunity over the course of the last 15 years to see the results. And so they're more willing and open to looking at it a little bit more. And there are some that are just very close minded. And I think you're going to see that most places that you go. You're going to see that mixed bag approach of people not even wanting to hear about it versus people that are actually seeking it out.
Now,
The
one of
thing
the
we have to realize as providers is that patients are seeking. They're looking for answers, and we want to provide them with substantial answers that are going to be helpful, so they're not stumbling into things that are not going to be helpful. So I think it's our obligation to keep things real and keep things safe for our patients.
I think one of the strongest trends, obviously, in the last 20 years is this where patients can get more access to information
Yes.
without having to go through their traditional healthcare provider or through traditional means. Yeah, where have you come in where where traditional medicine's failed and you've come in there and really helped make differences in people's lives?
Well, I think in the hormone world for certain. A lot of women are told that, at age 45, when they're fatigued and they have insomnia and they're brain fog, and they're told you're just getting older, deal with it. I mean, I hear that every day and it breaks my heart because that is not any way to live. But I think that's a huge failure in the world of conventional medicine. And it's just because I know on the conventional side, when I was doing women's health, we had very little tools in our toolboxes. We could deliver a baby for sure. We could do a hysterectomy for sure. And we could do a lot of good things. But balancing hormones was not one of the things that we were very good at. We used a lot of antidepressants. We used a lot of synthetic hormones to try to get symptom relief. But we didn't understand the physiology behind really truly balancing out those hormones and helping people understand that they could feel better and function better.
Well, why don't you think traditional medicine was good at that? Was it something systematic or
Yeah, I think
systemic?
it's systematic. I really do think it's systemic. I mean, I think providers, we want to do it, but that just wasn't on the radar. You just kind of expect that people should be able to figure that stuff out on their own, eat better, move and eat, right? Move and eat well. Those are simple, basic things that in the conventional world, I didn't have any tools or strategies other than to say, eat less, exercise more.
Mhm.
And that's really all I knew. And that doesn't work for most people. I mean, they need more detail and they need more structure to be able to pull that off. And the calories in and calories out in this world of toxicity doesn't really work that well either.
Mhm. Do you see, what do you see coming up on the horizon? I mean, I've heard a lot of different things that functional providers are doing, but what is it that you see that you're really passionate and excited about?
Well, I think that on the horizon, what I see is, I see a lot of information on peptides popping
Mhm.
up. I'm not peptide proficient right now, but I definitely have my eye on that arena, and I'm fascinated by what's coming in the way of peptides. So that's exciting to me. In the world of functional medicine, you will never be bored. There's always going to be new and exciting and
Mhm.
and things to look at and pursue. And being able to play a part in that, being able to be a part for our patient population to help them have access. I believe that everyone should have access to tools and resources to help them live a healthy lifestyle. I mean, we should have that at our fingertips. And being able to bring that to our patient population is really fun.
That's amazing. And I would think where you're located, you probably have people that come from more than just your local area.
Yeah, there are a lot of patients that will drive in for treatment for sure. Yeah.
That- That's amazing. I really appreciate Kelly spending the time with us, going over that. And that's great. I really appreciate you. Thank you for everything you're doing.
Awesome. Well, thanks for having me. This was awesome. I always like to share my voice when it comes to, again, spreading the word of functional medicine out in the community and just understanding what could be. What could you be doing for the community that you're serving as a provider?
Great. So if anybody's listening to the show and they want to get in touch with you, the name of your facility is Enhanced Wellness, and they can go to enhancedwellness.com.
Correct.
We'll make sure we have that in the show notes, and I really appreciate your time. Thank you so
Okay.
much.
Thanks so much. Take care.